Okay, well, we might get underway as there will be a few more people joining. So, firstly, thank you all for joining today. In similar words to what those who follow Simon Sinek, I'm going to start with a bit about why. So, why am I here today talking to you about innovation in health? Well, I'll tell you a quick story to put it into context. So, it was 2017, and I'd just come back from parental leave after the birth of my first daughter, Aaliyah, and I came back into a new role, which involved leading innovation. Now, I was a bit of a high achiever, and I was really looking forward to the challenge. The remit was broad. It was really around creating value for customers to drive growth. Now, with 4 million members, the opportunities were really high, and I was initially really excited. But then, when I tried to start doing things differently, focusing on new service offerings, there were significant resistance from people who I had otherwise good relationships with for years. There was tension and people were actually going out of their way to impede progress. Now, I had no resources to do this either, and people in management weren't willing to stop other things to give resources. And there was no business case. And to get a business case to get resources, I needed resources. I needed a business case to get resources. So it was a bit chicken and egg. So with frustration, we went to one of the big consultancies and they understood the issues and they'd seen it many times, which I've got to say was reassuring that it wasn't just me. But when they put together a 12-week program to help drive momentum, which sounded good, but it had a price tag of over $1 million for something that was so uncertain, high risk, it just wasn't viable. So through research, grit, and lots of determination, I was able to create an innovative product live into an MVP. And in doing so, I was also able to create an enterprise innovation practice, which built up over 14 initiatives in quite a short time. I'm very passionate about health, and I know that care deserves more. And I've since built my practice and helped many organisations, large and small, with innovation and transformation. So my name's Jodie Granger. I do specialise in innovation in healthcare, and I am the founder and director of Healthcare Innovated. I am really passionate about helping organisations, innovate in healthcare to create a better experience, better access, better outcomes at lower cost. I spent 14 years as a senior, the last number of years as a senior executive, focusing on strategy and innovation. And since then, I've been working amongst Calvary, Japara integration. I worked with HCF and Australian Unity, amongst others. I'm a CPA by trade. I have a postgraduate in innovation and design thinking through some pretty cool American universities. I teach at RMIT online in healthcare design, and I mentor for the CSIRO on Accelerate program. So my drive for better healthcare comes from my family history, where I grew up in Tasmania, a family with chronic disease. There wasn't support, and access was really hard. And when you did get it, it just wasn't a good customer experience. So what is today about? It is about sharing some ideas and experience that I've learned through theory and practice. There's no catch. I'm doing no more today than sharing ideas. I'm really passionate about magnifying and amplifying innovation in healthcare because it does deserve more and we can do it better. There's a lot of waste in health. And at the end, I'll share my details. No obligation, but today is really about getting the most from it. So being as patient and present as you can be. And hopefully, you will learn something new that you can take away today. So questions I have, Vera, a colleague who's a fellow panelist on this today, she's going to help moderate some of the questions. If you have any questions throughout, please do use the Q&A. There is also a chat function, so feel free to use the chat function, but any questions, certainly I'll either try and answer them as we go or at the end. And I'll also just have a short survey to get any feedback at the end. And then again, hopefully today you'll leave with a spring in your step to go and innovate. Hope all of that makes sense. So what does it mean when I say unlock opportunity? So what does it mean to innovate and unlock opportunity in terms of creating something that is repeatable, scalable, and profitable? We've all know the stories of Kodak, Blockbuster, the newspaper industry, the taxi industry, all who suffered at the lack of innovation. And I know that there are people in healthcare today, those that are in hospitals, that are undergoing immense pressure with changes in funding and changes in dynamics around home care. It really is important to be able to develop an innovation capability from inside out. So that's really building that. Yes, it's hard because there's BAU pressures, but you can't outsource this stuff. You've got to build a muscle inside. You want to be able to unlock the right opportunities faster and discount the wrong ones quickly. And simplify complexity. So I come back to reduce waste. Often people say, no, healthcare doesn't have the money to innovate. Many of us know the 60-30-10, 60% effective care, 30% waste and 10% harm. What can we do in that, that waste bucket? How can we really, and also obviously prevent the harm? So who's this presentation for? Healthcare leaders, large and small healthcare organisations. It's for healthcare innovators from frontline care facing to, digital entrepreneurs, and all of those who are equally frustrated with slow progress and things being harder than they should be to change. There's no shortage of wicked problems in healthcare. But some people might say, well, why bother? It's just too hard. There is too much ambiguity, uncertainty. We can barely afford to keep the lights on. How would we find the oxygen to innovate? Change is hard, right? There's conflict and tension, and a lot of people really fear change. And in healthcare, it's even more so that there's a lot at stake when it comes to innovating in health. And I think some people go, well, we can just outsource it to consultancies. So with all of those kind of, thinking and tensions, why innovate? Well, I think we know why we need to innovate inherently. But if we put it this way, so strategy, if we think about strategy, is critical to the sustainability and success of organisations generally. And I've not yet met one executive or board member that does not think strategy is a key part of their role. However, innovation often gets dismissed. And there's many reasons to innovate, be it to survive or thrive. And especially in today's world with AI coming down the track, and coming fast, as we know, healthcare is one of the industries that is most likely to benefit from AI, yet we need to have an innovation muscle. So if we think about it in that way, we think about strategy as leadership in the future. And if you think about leadership in the future being about adapting to change, which is what it is, and they say now it's no longer BAU, it's CAU, it's change as usual. Adapting to change equals innovation. So if we cut to the chase, strategy is innovation. So that is really important for organisations to know how to innovate to drive growth. So just quickly, I'm going to go into what is innovation. So I'm starting back at the beginning because there is confusion about this. And if you think about, Oxford Dictionary definitions, it's new methods, ideas, products. Experts in innovation tend to take the broadest view that innovation is anything that is new to you and has an uncertain outcome. So that doesn't mean it needs to be an invention. It doesn't need to be new generally. It needs to be new to you or your organisation, or you're using an asset in a different way. But it has an uncertain outcome. This is different than continuous improvement. And this is continuous improvement is that ongoing enhancement, incremental change. And look, both innovation and continuous improvement are very important to both are trying to make something better. But it's the way we manage them that is really important to understand. So if I think about the different types of innovation, so we think about efficiency. So on the exploit end, there's efficiency. So efficiency innovation is really about exploring opportunities that improve aspects of your existing business model, but they don't change your existing model in a substantial, significant way. Sustaining innovation is really about exploring opportunities that you build on top of your business model to strengthen it and keep it alive. And then you're transformative. So this is the most difficult innovation. And it is about exploring opportunities that require a radical change or an expansion of your business model. So here I like to use the example of Amazon because most people are familiar with Amazon. So if you take efficiency with Amazon, so they implement robots in their warehouses. It's very innovative and it improves the efficiency of their warehouse management. But robots in warehouses won't protect Amazon's e-commerce business model in the event that it faces some disruption. If you think about Amazon and sustaining innovation, when Amazon launched their ebooks and e-Kindle, this added a lot of value to their online bookstore and significantly increased their revenue streams. And then there's transformative innovations with Amazon is really around, through their e-commerce business, they developed a lot of strength in IT. So that led to the creation of their Amazon Web Services that now lives next to their e-commerce business. And we all know how successful that's been. Now, look, most companies aren't Amazon. Most companies don't innovate like Amazon. However, most companies do have a significant proportion of their innovation portfolio geared towards efficiency, with a low percentage in sustaining and very, very few in transforming. The issue with that is it's this type, the transformative innovation, that has the highest long-term value and creates the protection from disruption. So it is important to innovate. But why does it feel harder in health? I'm sure, those of us who've worked in different industries go, oh, health is so much harder. Well, according to Harvard Medical School, there are factors that affect the healthcare industry that do make it a little bit more hard, but certainly not impossible. And we think about financial incentives. So unlike other industries, the healthcare incentives aren't always aligned. So you've got hospitals and doctors, insurers, all work on different financial models. Innovation might be financially attractive to one, may not be to another, leading to resistance and slow adoption. You've got diverse, interdependent stakeholders, patients, doctors, nurses often have diverging goals, and any change has to meet for a vast array of interests and needs. You've got an extensive knowledge base, so medical field is vast and continuously evolving. You do need that, really strong understanding of different specialties, treatments, protocols. So that can make it hard to make sure everything we're doing is safe and effective. It's difficult to measure outputs. So, for example, if you put in a new system, it's really hard to determine direct impact on patient outcomes versus other variables. You've got a complex production process. So, the delivery of care is multifaceted. And innovations need to fit seamlessly into these processes without disrupting care, which can be a bit of a tall order. And regulation. So as we know, quite rightly, healthcare is a regulated sector. Any innovation must adhere to the guidelines, national, international standards, and it can slow down the adoption of new technologies and approaches. So, there are a lot of kind of macro issues when we think about healthcare. And then there are some others. So there are some other common problems. I'm sure you can relate to one or maybe some of these. Bridging the gap between current profitability demands and future readiness. Do you feel like you're spinning wheels and can't get decisions made? Because I certainly did. Struggling with resource and funding issues. Health is low margin game. People don't get into health to make a lot of money. Yet, profit's like oxygen. It's not the reason we live, but we need it to live. So we've got to keep an eye on all things sustainability. Unable to bring stakeholders on board. It can be really complex. Lacking team skills. Again, you don't always have, some of the corporate or the digital type skills that you need for innovation. And then finding it difficult for all the reasons we just discussed to navigate health system complexity. So I'm sure you can connect or relate to some of those. And that's what we're here today to talk about. How do we unlock opportunity faster. So what does that mean? Well, if I think about building internal capability to iterate, test and learn, it's really building that muscle and shifting mindset from legacy to future. So what did I do when I set up the innovation practice? It was really about setting up an innovation council with really a good cross-section of the enterprise, senior representation. And it took activity that was happening off the side of people's desks and took it away from the HIPPO, or the highest paid person's opinion, to whether something would get funded or not. And the 3 criteria we had for entry was it new to the organisation? Was it cross-functional? And was it too uncertain to go straight to a business case? And this Innovation Council really gave visibility, support, and some seed funding to be able to move things along. Unlocking opportunity means you need to fast track the generation and assessment of new concepts and discount the wrong ones quickly, right? That's the thing about innovation. It is uncertain. You will go up a lot of wrong paths. That's okay. You've just got to know they're the wrong path as quickly as you can. And so, you know, we had 14 initiatives go through. One was the Microsoft HoloLens device that we were going to use for rehab in the home. And previously, we would have made a large bet on it. Yet we tested it with 5 customers and providers and realised it was not really needed, so we stopped talking about it. And then thinking about how can you repeat successful initiatives, adapt to work across the healthcare system. So if you've got a portfolio approach, you might have 10 initiatives go through at, say, $1 million for seed funding. Of those 10, you might get 4, which can go through to MVP, which you might then invest another 3 million, just to get 1 to 2, which are your 10Xs. And that means that they will pay back the investment over the 10, just like VCs do. Now, that's what we want to achieve, but what are some of the common mistakes that organisations make in trying to pursue and achieve these innovations? Well, one is asking BAU teams to innovate. Business as usual is the performance engine. They want to go faster and stronger. They do not have the time to focus on innovation. We underestimate their resistance, and we don't directly address the problems, especially in middle management. Things get stuck. We jump into innovations without a strategy. Now, a well-defined innovation strategy has got to be flexible to respond to changes, but having a strategy to set you on course is really important. People treat innovation like a well-defined project. All right, give me a project manager and a business analyst and off you go. Well, hang on, where's the scope? There is no scope because we haven't got one yet. Overemphasis on tech development. I'm sure there'll be no surprise here. Tech is really important as an enabler, but should it never drive innovation on its own? Inadequate skill development and support, expecting employees to adapt without significant support, pulling people off that may have been, you know, high achievers in certain areas and saying, well, they'll do that, but then giving them no training. Lack of clarity in design and key assumptions which require validating. We'll talk a bit about that. And finally, not having the right performance measures in place at the right time for people and innovation metrics. So, and this includes the discipline to stop and review for stop, pivot, continue type decisions. So they're the sort of 8 common mistakes that a lot of people make when it comes to innovation. So obviously people are asking, well, how do we overcome these obstacles? So I come back to my objectives of simplifying things as much as possible. So I like to use an ABC approach. And these are proven principles for successful innovation. So the A means align from the top. As we know, easier said than done, but we've got to have at least an 80% alignment at the executive, right? That doesn't mean agreement. As we know, execs won't always agree, but you've got to be aligned on pursuing that, because if you don't get alignment there, you will get dysfunction vertically, and that will become horizontal across the organization. And it will definitely slow things down. So that clear purpose, innovation strategy, align digital position, align change competence and cultural understanding. Build. So a lot of people have different build methodologies, and that's totally fine, but you need to have one. You need to build business-led momentum for change, build repeatable design methodologies, create the design, and agree on the solution. And then the C is commitment. Commit to the future. So you've got to have the right commitments in place. Otherwise, people get halfway across the bridge, and guess what? It gets too hard. Competition comes, control issues, all of these things that are going to throw you off course. People go, actually, the grass looks greener over there, but I think I'm going to go back to what is safe and has less hassle because it's less hard, basically. So we need to make sure that we give people the opportunity over the idea. Ideas come and go, but the opportunity needs to be committed to. We need to confirm and commit performance criteria. So don't wait and then say, well, we thought we'd get about half people of our intended audience using it. You need to have criteria in place first, because if you do, it means that you can go back and have something that's more disciplined to measure. And discipline is really important when it comes to innovation, because people kind of think, oh, innovation's kind of, you know, the fun stuff with rooms full of post-it notes and it's a bit kind of loose. And that's why perhaps it's not given the attention it's often required at higher levels. It needs to be really disciplined. So if we say that we're going to start, if we start off with our challenges, right? So we've got our tension that we've talked about between current demands and future readiness. We've got talent and agility bottlenecks in the organisation, and we know that there's funding and complexity issues within the healthcare system. But we want to get over that bridge that I was talking about. And the results mean we want to unlock the right opportunities faster. We want to develop innovation capability from the inside out. And we want to simplify complexity and reduce waste and partner across the ecosystem. So we align, as I mentioned. What are some of the things that we can do to enable that? So I talked about the type of things that you have to show that you have alignment, but how do you get it? So one of the key things is you need to understand where you are today. So you need to do a diagnostic. You know, we're in health, we need to understand current state diagnostic. We then need to, you know, bring executives and board on board, and a really good facilitated workshop is really important to that. And I'd suggest you're bringing somebody that speaks executive language, and you know, certainly, you know, I run workshops, but I know there are a lot of other people that do. You need to have a good facilitator, because within a half a day or a day, you can really achieve more than some people try and do by doing it on 1 hour meetings here and there, or adding it to the end of an already existing meeting. It won't happen. Commit to the workshops. Change management support is critical. And I don't mean sort of change management kind of, you know, look at a, you know, a change impact assessment, right? This is not that kind of change, right? This is looking at where is our organisation at an adaptive change level. You need strategic road mapping and innovation, you know, an innovation blueprint, you know, thinking about jobs, customer jobs to be done, those kind of things really helps with that. And peppered throughout should be market intelligence. So once you've got your alignment, you've got your build. So this is building your iterative solution. So your prototype development, you do your tech matchmaking, you run your collaborative workshops, design thinking sessions. You get a team build for dedicated focus. Don't try and do it off the side of your desk. You need to have dedicated resources that have done this before, not just pulling some people out that put their hand up. They need, you can bring in a little bit of that, but you really need to have people that know what they're doing and to help with that capability build in the organisation. And then simulation and experimentation. They're so underused and they're so powerful. So if you think about, you know, when you're reading a bunch of requirements in a document, it's dry, and you're not really able to bring it to life. So the ability of role playing and simulating is really, really important, as is, you know, doing short, sharp experiments, which we'll talk about. And then commitment. So we think about is sort of innovation training and capability building, feedback loops, incredibly important. Performance analytics and innovation measurements, which are different than your standard profitability measures. And mentoring. Mentoring is so important. Reverse mentoring. You know, with one organisation I worked with, we had the clinical workforce being mentored by some of the digital team that were, you know, sort of much younger, didn't know that much about health, but could bring a lot of new thinking to clinicians that were more experienced, but without those skills. So just think about, it doesn't need to be very expensive. It just needs to be sort of collaborative. Now, timeframes. So people think that this is just too hard or it never happened. Now, you can do a lot in a relatively short time. In your align and build phase, depending on where you are, can be anywhere from 0 to 12 months to get a lighthouse project, which is kind of like an MVP up and running that you can learn from and use to build your practice. But look, the costs aren't high, especially when you compare it to the cost of M&A. So M&A, people spend a lot of time on kicking the tires, and it often, if you do go through due diligence and you do go ahead to acquire, we know the pains involved in it. Now, I'm not saying M&A is not a good strategy, but I think organic growth is a very underutilized one. Some guys that I work with that are very knowledgeable in corporate innovation, they've done some work on return on investment. And, you know, if you are committing to your practice and not giving it up for 5 years, so yes, you're changing things, but stay committed to your innovation practice, the return on investment for organic growth is much higher than it is with M&A. By the time you often run into a whole bunch of cultural issues that you never thought you were going to have when it comes to M&A. So that is a bit of a roadmap, if you like, to a pathway to get from your challenges to your results. And so it's not as hard as a lot of people think. However, it is important to always remember that innovation is not disruptive, adoption is. So you can innovate all you like, but if it's not very effective, you've got to learn, as I said, have that discipline. And it's also important to use the principles of human-centered design. So it needs to be really user-driven. Now, it also needs to ensure consideration of success and not lead to another pilot. As I'm sure some of us have heard Health Minister Mark Butler say, healthcare in Australia has more pilots than Qantas, and it's true. We need to be, building something and understanding when the right time to scale is. So if I think about some of the concepts I've just spoken about, I'll give you an example of healthcare, some healthcare case studies. So the first case study, I'll give you an example. I was doing some work with a health and an aged care provider. They had 70 aged care homes across Australia. They all had different ways of doing things. And they had some quite concerning occupancy issues. So, we've got a lot of infrastructure in aged care homes. The beds need to be occupied. So many projects had been attempted before, but without alignment. So many came in and went, oh, it's about marketing. We need more advertising. We need to fix our website. And so what we did was we created alignment. We created some executive sponsorship and support. We then focused some streams on customer pain points, and we actually got some of the home managers and other people that were working in the homes to actually do the customer interviews with us. And that was really powerful, because what it meant was they were hearing issues that they kind of glossed over in their day-to-day role, and they were hearing it directly from the customer, which is really important. So what that did was then helped us move through the recommendations. And it was actually nothing to do with we could have invested a lot in marketing, but it was actually nothing to do that. A lot of it was about how you contract, right? So the contracting in the home, the type of roles that people were doing was making it really hard to give people the attention that they needed. So what came out of that was really a focused program. It was short and sharp. We had it from sort of 3 months where we did the whole diagnostic piece to 6 months later, we were doing training to 300 home managers and clinical staff in those homes, and learning things about aged care that they should know but they didn't. And it created much more standardization, collaboration, and more pride as well in what they were doing, because they were really connecting to customers. For a health insurer, so find, quote, book and pay, this was about trying to create more value for members, leveraging the brand, but we had no resources to do it. So this is, again, we did some customer and provider interviews, really understood what their priorities were. And we then got the importance of iterative build. We got 3 executives in the organisation to tip in a little bit of money each, which also created a lot more stickiness and buy-in. And we then were able to build got to MVP. So if you are still a Medibank member, you were able to book an appointment with a dentist on your phone, find out how much it's going to cost, and make that direct booking, and obviously digitally pay. Now, that was about in the beta testing that we did. We had 40,000 customers in the first 3 to 6 months go through the booking process, and then we had 5,000 book. Now, we didn't have enough providers on, because any platform business is chicken and egg, but it did again highlight that we were going in the right direction, that customers valued it. And then in terms of a home health provider, so looking at really wanting to look at how do we bring in the concept of an MDT squad, so similar to sort of Bertsorg, bringing in more multidisciplinary teams working together, looking at a health concierge, focusing on care partnering, and focusing on a more scalable model. Now, they've decided to go down an experiment path. So in one of their locations, they're testing it with 140 staff, 2,000 customers, where people are acting in new roles. Now, this showcases commitment, because they're going to roll out a brand new system, and the learnings they're going to get for that are going to help continuing to iterate in an experiment. So whether it's large or small pieces of work, it all starts with that understanding of customer and employee pains, and it requires alignment, build and test and learn methodology. So that's great, but how do we measure benefits? Now, I'm a CPA, so I get it. What you measure matters. So what do we need to do to measure benefits? Well, let's start at the highest level. We say, well, let's look at the quintuple aim of healthcare and measures. Now, I always laugh at this, because when I started in health 20 odd years ago, we were always focused on the triple aim of health, and then it went to the quadruple aim, and now we're at the quintuple aim. But it's really a nice way to show how are the different tensions in health being, sort of pulled against each other, and you really need a balanced approach. So we think about customers. So we need to be able to measure improved experience for people, families and carers. So you can use NPS, you can use complaints and compliments, speed to referral, time of service, PREMs or other patient-reported experience measures. And clinicians. So we know that through COVID and post, clinicians have had a lot of burnout. We really need to make sure we focus on an improved experience for employees, if they're your clinicians working for you, or service providers. You can measure that through ENPS or other surveys. Participation in programs and referrals. Really important to see whether, if GPs aren't referring, it's usually an indication that they're not interested, or you haven't connected the dots to their workflow well. And there should be mutually beneficial reward measures. There is, as we talked about earlier, healthcare isn't a win-win-win game. Often it's a win-loss-win game, or whichever way you go. But it's important to try and think about how do you use mutually beneficial rewards, and then increase satisfaction, reduce stress. Outcomes, very important. Obviously, we want to improve outcomes for the population, but how do we measure that? So it could be average length of stay in hospital, PROMs, so patient-reported outcome measures, hospital-acquired complications, 28-day unplanned readmits, number and type of clinical incidents, or disease-specific measures. So there's a number of different ways we measure that. Cost, very important. I talked about profit being our oxygen. we need to make sure that we improve the value by efficiency of the health system. So return on investment, or it's got to be delivery at services at less cost than current, right? So that's, health insurers will often go, no, I'm not paying for that because it's additive. People go, but that's not fair. But again, we're trying to keep costs down through the system. So we've got to look at how are we substituting, or how are we taking cost out if we're adding cost in somewhere else. Operational effectiveness and efficiency of the service. I talked about waste. How do we measure the waste, time, motion, those kind of things? We should be measuring NPV, of course, and also innovation as a percentage of revenue. Again, if you're not innovating, you're not likely to survive in the long term. So you need to put ways in the visibility pieces that people can look in and say, we are investing, and are we getting returns? And also design for environment considerations is really important in healthcare. We are a big culprit for using a lot of disposables, often for good reason. But again, we always need to be thinking about how do we design things that are going to be beneficial for the environment. And then last but not least, equity of access should be within all 4 quadrants. However, as we know, sadly, in Australia, the fairer your skin and the closer you live into the city, the better your health outcomes are going to be. And that's just not right. So we should be thinking about designing health solutions for our Indigenous population and working backwards, because unfortunately they have the lowest or the worst of our health outcomes. So thinking about those kind of measures is really important. But some of those things take a long time to prove out. I hear you say, of course they do. And we can't be asking executives, just hang on, it's going to happen, we're going to get there, give us time. We need to show some things on the way that we know that we're heading in the right direction. And this is where it comes to our assumption, our hypothesis testing. So I often like to use a lean business model canvas, which I'm sure many of you are familiar with, but you fill out your lean canvas and you pull out your assumptions. You will always be surprised how many assumptions that you are making when you're developing an innovation. It might be 15, it might be 20, etc. So you list them all down. I've oversimplified some here, but list them all down. And then you need to rate them. So give it an objective measure, which just helps you focus your limited resources in the right direction. So what's the consequence if you're wrong? If this is an assumption that you've just completely mucked up, right? If it's 1, it's minor and it's not really that important to the innovation. You can keep going. But 5 means it's severe. You're going to ruin the whole thing. Versus what's your certainty? So if you're all certain, right, of an assumption you'll make, customers will adopt the change. I know they're going to do this, for example, because of X, Y, Z. It means that you'd put a lower number, whereas 5 is a wild guess and you've got no idea. And then you simply add the numbers together. Whatever the highest ones are the ones you should test first. Really important. So, I tell the story of somebody that I used to mentor, and I had a great app that was used in primary care and was being piloted amongst a number of GP practices. And I said to him after he'd been in pilot for 3 to 6 months in, I think, 20 practices, I said, how's it going? And he said, well, I don't know, that, receptionists, that they love it. The practice managers just love it. The nurses, they think it's fantastic. I said, but what about he said, the customers? Customers really, really love it. Right, but what about the doctors, the GPs? Yeah, no, they won't use it. Well, why didn't you test that first? He said, it's just too hard to. It was easier to test the other things. Now, he'd then probably burned 100 grand doing that, testing with the people that it wasn't really that important whether they liked it, because if you're a GP, you're the one that needs to use it. So, So once you've got that, how are we going to go through and measure it? How are we going to give executives the importance of the methodology for experiment testing? So we make an assumption. So we get our assumption list. We believe that. What is the assumption? So let's take GPs, okay? So that GPs will use this to refer. All right, to verify it, what will we do? So we might say, well, we'll test it with 100 GPs or 20 GPs over a 3-month period. So be very specific. okay, what are the measures that we're going to look at? So lead and lag, quant and qual, you know, and then thinking about what is it that you think you need to prove that out? And then your dependency. So how are you going to test it? What are the people, the systems, the responsibilities? And then what's the result? So if we think that out of 100 GPs, we're going to get 60 using it reasonably consistently, and if we only get 20, right, what if we're, you know, what's that mean? Is that, are we going to change what we're doing? Are we going to stop? Are we going to back to the drawing board? So it's important to start to think about that at the beginning. It just adds that sense of discipline. But how do we govern innovation? So we're doing all of this stuff. People don't necessarily like the innovation people running off in a lab and being, you know, not governed at all. So we do need to govern innovation, but not necessarily in this way that I'm showing here now. It's you know, you can't govern innovation the same way as established business. It's got to be proportionate, fit for purpose, and have visibility. And it's got to follow measures that determine its likelihood of success and not measured against well-established business operations. So leaders should not be measured in the same way, for example, as existing KPIs. Otherwise, you won't get the best people wanting to work in innovation because it's too uncertain. We all know that leaders who don't meet performance, they're usually managed out. So don't give artificial things with innovation that they're never going to meet. It's about learning and it's about innovation, and leaders, innovation leaders, in my view, should report to C-suite and be measured on progress and learnings of the innovation portfolio. So the governance is important. Measurement around portfolio management. Portfolio management is really just having a really simple way to bring your ideas together. And if I think about the idea, you know, the number of ideas, you then are tracking them. Now you can use red, amber, green, you can use whatever you like. In fact, we had one client who didn't want to use red because red implies something bad, whereas we're learning here, so they made it purple. But it means stop. If you've got too much green on your page, it's actually not a good thing because it means you're probably doing too much work before it gets to the innovation council or the innovation practice. But this gives you a good idea of portfolio thinking and having a mix of things, some things good, some things bad. A clear formula makes innovation easier. So innovation doesn't need to be big and fancy. I think hopefully I've showed you that today. And you're probably already embarking on it. However, using a framework and some tools to work through that ambiguity really does work. And you know, that for me, as I said, innovation in health is super important. So my why is, you know, my passion for health. I grew up, as I mentioned, in Tasmania. My mother was bedridden for 18 months when I was very young with chronic fatigue, and no one could help her. She consistently had multi-morbidities connected to her conditions, and nobody treated her in an integrated way. It was just so piecemeal and not a good result. And similarly, my brother, Paul, my younger brother had mental health issues and they weren't managed. We were frustrated. There was lack of access. And sadly, we lost Paul when he was 29, and we didn't need to. My father was a man who didn't share his woes very well, not dissimilar to a lot of men, although hopefully getting better. He surprisingly suicided at 43. My younger sister battled many health issues when she was young and had breast cancer at 30. Thankfully, she's all good now, and maybe even on this webinar. But these are the issues that I've experienced firsthand and has spurred me to continually innovate for better health. So at Healthcare Innovated, our mission is to transform healthcare through innovation, empathy, and excellence, because care deserves more. Our vision is, we see a world where everyone has access to the best possible healthcare because care deserves more. And our values are to innovate, we want to improve care, and importantly, have fun. And so hopefully you've had some value today, and I'll stop in a moment if anyone's got any questions. But this is how you contact us if you want to have a no cost, no obligation conversation about how some of these tools and more can help. And I'll also have a short 4-question survey at the end of this. Really just tell me what else you might like to know about. Again, our purpose is about amplifying innovation in healthcare. So I will stop there. If anyone wants to come off mute, I can do that, or you can put a question in the I have a question in the chat. I'm just having a look at alignment. So I think we've got a question here around alignment. How can we achieve? Yeah, look, it's a really good question. Alignment is the most important part. Without alignment, we just become so dysfunctional. How do we achieve it? Look, I think it's got to be creating the platform, the burning platform, but it's got to start at the board level. Now, at the board level, we often get a lot of, lawyers and accountants, and I say that with respect because I'm an accountant myself, but there's a lot of people in there that don't necessarily understand innovation or new ways of working, kind of very traditional thinking. It is important, we're starting to see boards doing more junkets, if you like, or travels. Certainly at Medibank, when our board went to Silicon Valley and learned from Kaiser Permanente and others, it definitely made a difference to their openness and their understanding. Getting some runs on the board definitely helps. So showing different ways of doing in a no low threat way. I think having good strong leadership is important, and as I said, the really important thing to do is to have those workshops and get the outcomes and commitment out as soon as you can. So if you're going to do it, great, have a really good workshop that you can work through to get the alignment with a really good facilitator, can work magic. If you're not going to do it, get them to agree you're not going to do it and move on. In fact, I've got time for a very quick story. There's a lady called Natalie Cook, who's sorry, not Natalie Cook, Natalie Smith, I think. Sorry, Natalie. If you're on she did a PhD in digital transformations in healthcare, and one of the things she termed was the Chardonnay terrorist, because all the digital transformations that she studied in healthcare, the ones that had the alignment of the board and people supporting each other were far more successful. The Chardonnay terrorist line came from when there was an offsite and there'd been a big rah-rah during the day with the CEO and others that this is what we were going to do. And then after a couple of Chardonnays, one of the executives came up and said, yeah, this is great, but it's never going to happen. So I think we've really got to stamp out the Chardonnay terrorist. We've got to be really strong on alignment. Otherwise, organisations won't continue to thrive. Another question there. Right, what have we got here? Could the slides be emailed, please? Yes, we can share those slides. I will share. I think they're all very shareable. Are there any other questions? What have we got in here? Balancing the notion that innovation in healthcare needs to be substitutive and manage the systems change amongst stakeholders who are being substituted out. Yeah, very, very, very good and very, very challenging. I think it's having the people involved and trying getting them to be involved in the future. So people that are really concerned about the past and the loss, about what that's going to mean for them and their skill set. And these are, doctors or specialists, etc., that have maybe spent 40, 50 years doing what they know. And all of a sudden we're coming along and saying, actually, there's some innovation over here. There's something digital that's going to replace you. It's really about, having really high empathy, getting them really involved in understanding what their skill set, what their knowledge can do to help in amplifying this, maybe digital piece that can help, again, with the accessibility of healthcare in areas that we could never reach before. It is really challenging. It's challenging for, hospital CEOs that are running businesses that, they're seeing empty beds, they're seeing health funds wanting to do it in different ways. It's really challenging. Again, it's really trying to, how do we get them focused on the new and what their skill sets can be used for in the future, because there's, as I said, no shortage of wicked problems. Hopefully that helps a bit. Any other questions? If you want to raise your hand, I can take you off mute if anybody wanted to, or put it in the chat. Otherwise, I will, I think, let me see if I can stop the share here. And I think there will be, if not in here, there should be a survey being sent to you all at the end of this, and I'd love your feedback to what was useful and what you might like to see more of, and we might be running some more of these in the future. We'll do some that are similar content, some that is new content that might take it to the next level, which really looks at some more frameworks around how you in a more detailed way move from your vision to delivery. So if you've got people that you think would be interested, please send them to our website and get them to register. The more interest we have, the more we can run.
Julie, there's a question in the chat.
Okay.
From Dan.
Okay, just a second. Is it appropriate to tell their staff what they're doing and expect to just do? A very good question, Dan. I think in today's age, where we're no longer working in an autocratic type, widget producing factories, no, I never think that's it's okay to do that. I do, however, think that there is a path that says this, if we've got alignment and this is the way that we're moving, and somebody doesn't want to be on that path, then I think it's totally fine to have that discussion that maybe they're not part of the future. However, I think it's always important. I had some people at one of my clients say, no, we don't need to talk to our customers. We know what our customers think, and wanted to dismiss it quickly. I convinced through a lot of convincing that they should, in fact, listen, come and do the interviews with me, to which they did, and they were very surprised to what they heard. So I think it's trying to find different ways that you can shift mindsets, even if it's gradually, and then sharing the storytelling is important. Anybody else? Any questions? No? Well, I think we'll leave you a few minutes, quick bathroom break before people have to run back to work or back to the next meeting. So once again, thank you very much for joining. I love what I do. I love helping organisations try and innovate, and I really thank you all for joining and being part of the cause. Thank you.